Q&A, can I have a bit of silence, please? Okay, yesterday evening I left tables number 7 and 14 on a promise, figuratively speaking, of course, that I would call you in first. So can I ask tables 7 and 14 first of all, and then if the roaming mics can be ready for tables 4 and 11 after that. So table 7 first and then 14.
Yeah, hello. We're just wondering about the preventive policies in place because we've seen kids are bored and there's not much sports center or things to do. So we would like to recommend and ask what are the policies in place with regard to prevention, with regard to kids having an alternative, what to do like in their spare time in terms of sports and affordable centers where they can really go and engage with and have fun instead of going to cannabis or something else. Thank you.
Okay, thank you very much. And I'll come to that now. Just on table 14, if we can, please.
Hey there. Eddie, you were calling for a brave step to take against the drug war. Would selling drugs with monitoring, regulations and quality control, would that be brave enough?
Okay, so if I can maybe, actually Eddie, I'll go to the second question first, just directly to yourself. Quality control, prevention, regulation.
Yeah, for us, that's the brave step what we're looking for, and we're looking for it for not just cannabis. I know the focus today has been a lot on cannabis, but cocaine is the big money maker for the gangs, and I disagree with Bobby from the point of view, if we take the huge profits out of it, the gangs will not exist at that same level. If we sell it at below the price that they can make money from, they will go. There will still be criminal activity, but not at the same level.
Anne, can I ask you maybe if you have a view on that, and then I'll come to Bobby.
I suppose that part of the issue here is that, again, I'm not an expert on the legal end of things, but I suppose what we see in other jurisdictions is that when things become more available and when things become more acceptable, we see increased rates of use. So if we use the example from, I don't know if you remember 10 years ago, there was a major surge in head shop drugs. So I remember at the time I was a very junior doctor. I worked in the matter emergency department at that point in time as well. And I used to pass 10 to 15 of these shops every day as I walked to work through the city centre. And then you get to work and every single day we would have 3 or 4 young people who would be extremely, extremely unwell, acutely intoxicated, needing security, 3 or 4 people to sit on them because they were so agitated and so unwell. It was absolutely unbelievable. And this continued. And as part of our assessment, we'd wait until they sobered up and we'd have a chat and we'd, do what Bobby described about you'd have that conversation where you try to say, come on guys now, let's think about how we can have an alternative here to using these head shop drugs that are clearly not working. You're ending up here in our emergency department. And they would always turn around and go, what's wrong with you? They're legal. I'm perfectly entitled to take them. And this might be a 16-year-old. And it became very difficult to give those messages because there was this real message of acceptability that these drugs are fine, they're legal, ergo they are okay. And it was really interesting that when the head shop drugs closed about 2 years later, we saw a massive decrease again in those types of presentations of young people. And they were so unwell. There was one guy and he came in and he literally, the whole emergency department ground to a stop. He pulled a radiator off the wall, he threw it across the ED. It was absolutely, I can't fully describe the level of chaos that happens.
Okay, and I just want to let some of the others in as well.
Sorry, thank
you. I'm going to go to Graham first and then Bobby.
Yeah, we'd agree. I know our presentation was primarily focused on cannabis, but we'd agree that with regulation, already the A&Es are full of people that are taking drugs. They don't know what's in them. I also have worked in the matter A&E, and I've met people. I've met a man who overdosed before, and he told me when he kind of came around that normally he takes 2 blue pills, and this time his dealer didn't have blue pills, so he got yellow pills, and he took 2 of them, and his mother found them overdosing. So these people are already ending up in A&E. I've nursed people that have been psychotic as well, sometimes not to do with drugs, it can be a nature of it, or to do with alcohol, or maybe alcohol withdrawals. But with a dangerous drug like alcohol, we put regulations in place so that people aren't drinking paint strip or going blind from it and that kind of stuff, which I think we've seen when they tried to prohibit it in the United States. So I do think this kind of, I know Eddie is calling it a brave step, I'd say it's the most sensible step to remove the morality from the issue. The fact is, people will do drugs. Cannabis has been used for thousands of years, all the way back as ancient Egypt. So people are going to use drugs, people are going to alter their minds. Same thing about on my thing, I had people jumping out of a plane. some people wouldn't agree with that or they wouldn't want to do it, but we don't allow people not to do that or try and police them away from doing it.
Okay, Graham.
Thanks.
Just gonna get, no, Bobby?
I suppose in terms of what might happen if we legalise drugs, I think all we can do is look for the evidence of what's happening right now in the States and Canada. And what's happening is you get a race to the bottom in terms of a competition between the criminal suppliers and the regulated suppliers. So potency increases and prices drop. That makes drugs more affordable, and it's a more dangerous drug that's affordable to more people, and that is driving up health problems. This has nothing to do with morality. This is entirely a health-based issue. We will have more people in our emergency departments with health problems if we regulate drugs. And again, just on the point, we have already a regulated drug. It's called alcohol. And in terms of single substance overdoses in Ireland, what drug causes the most fatal overdoses in Ireland, single substance? It is alcohol. It's ahead of heroin, it's ahead of cocaine. So the fact it's legally available, regulated, of known purity and potency does not stop the deaths.
Okay, Bobby, thanks. And look, I just want to be fair to Eddie, who was brief at the start. Did you want to come back in, Eddie?
Well, just that nobody's suggesting we return to a situation where cannabis or cocaine will be sold from unregulated outlets like the head shops. We're not talking about that, you know. That was a, you know, we all agree that was an absolute disaster, and it's one of the reasons why we want the regulation to be through either government outlets or pharmacy chains that already distribute drugs like methadone to 10,000 people every day.
Okay, can I just go to the second question, which was from, sorry, the question related from Table 7 related to, as I pick it up, availability of other funded activities, availability for them for younger people to use, and leisure activities to avoid them getting involved in drugs. So maybe, can I just go to Graham first on this one?
It wouldn't really be my remit now to advise on what prevention is in place. From my own experience growing up and why the stop and search was I grew up in kind of an overly policed area when I was younger, so I was stopped and searched by the Gardaí numerous times, and I don't think it done much good to build community relations or to encourage me to engage. Luckily I was never convicted of a criminal offence, so I was able to go to college and to get a degree, and I'd never have any of the jobs that I worked if I had been prosecuted. So I know it's kind of a little bit off topic,
no problem.
But I would have found that me and some people that I hung around with would have had a hard time to engage with any kind of Garda-led community outlets or that type of stuff. There was a youth club on that, but it was very difficult to get people to engage.
Okay, Graham. Eddie, I know you're very involved in Sword Celtic anyway, if nothing else, but you don't hold that against you.
Okay, I suppose most of us would advocate for something like the Icelandic model. So Iceland had the highest level of teenage alcohol misuse and antisocial behaviour because of that. And they developed this thing called the Reykjavik card, which was, they provided free access or very, very cheap access to every young person after school every day to youth activity. Now it meant huge investment in sport and the arts and recreation. They also invested in transport because they understood those young people needed to get from their school, did this activity, and their parents were probably working. So obviously that model has gone really, really well in Iceland. It's been piloted here, but piloting it is no good. Either we're going to massively invest in it, or we're not going to do it, or it'll have no impact. And the second thing I'd say is, you know, I have never seen on social media or national media a really good health promotion campaign around the dangers of drug use. We've seen how successful that has been in terms of smoking. We've seen how successful that has been in terms of things like drink driving. I just don't understand why we don't invest in health promotion around the dangers of drug use. Okay. Young people aren't stupid. You know, 50% of them make a decision at 16. I don't want to drink alcohol at the moment for good reasons. You know, 75% of them have made a decision. I don't want to smoke cigarettes, even though they're legally available, because I don't think they're good for me. Okay, so, you know, young people aren't stupid, but let's give them the information.
And I see nodding heads of agreement around education and prevention across the table. So, but I do want to get more questions in. Table 4 and then Table 11, please.
Hi, good morning. Thank you very much for the presentation. It was very jarring on the table, and I suppose that's part of why we're here, and we liked that. Our question was, in terms of legalization, how exactly is that supposed to work? Is it a case where it's the government that's going to start producing these drugs? Is it pharmacies? How exactly does that work and compared to other nations? And Has there been any data to show in countries where legalization is in effect that the criminal activity has significantly reduced?
Okay, and with the agreement from table 4, can I just hold the first part of the question? What does legislation mean? What would it look like? But I will ask panel, because we will have the next session, and I'll make sure it's posed. But we will ask panel just in terms of evidence and data in a second. Table, sorry, 11, please.
Good morning. I just wanted to ask, just in regards to, I think, was it Bobby kind of shared statistics regarding like juveniles using cannabis, and their kind of main reason, or I guess the main thing they got out of it was recreation. They, you know, they kind of do it for pleasure, for fun. I went, like, you know, through the, like, you know, people my age, we go through the latest form of SPHE and, you know, I guess, you know, kind of prevention before cure. But if drug rates are rising, it's just the current system in schools just not working. If young people just seem to almost, you know, they know the drugs are bad for them, like, you know, SPHE, teachers and all that just tells them that it is, but they just don't care almost that it's bad for them.
Very good. Well, good point made. And can I just maybe ask panel, and feel free to reference both questions, but sorry, certainly one related to what is the evidence since other administrations may have legalised or decriminalised? And secondly, I think a really good point here about if people are hearing it at various stages of education, why is it not making an impact? So, Bobby, can I go to you first?
Yeah. I'd say thank you for asking the question about how this model of regulation is going to work, because it does seem to me that what I hear the bulk of the time from people who want legalisation is that they spend 90% of their time just slagging off our current system without really articulating what exactly they're going to replace it with. So it would be great to get clarity on that. In terms of what's happened in other jurisdictions, a challenge Ireland would face if we legalise, and any country in Europe will face this. It's a bit like the states in the US that have legalised cannabis. The organised crime groups then move into those states, and they use that. The organised crime gangs operate from the locations which have the most liberal policies. So they've moved into California, Colorado, and they then supply the rest of the states from there. So we should expect that to happen in Ireland, and Germany should expect that to happen if or when it legalises as well, that to supply the rest of Europe, the gangs will descend on Ireland. The question about SPHE, you know, and prevention. SPHE is a decent program. I think schools maybe need a little bit more support in actually rolling it out. But it's only one source of information for young people. There was international research, and I'm sure it's the same in Ireland, indicating that the majority of social media posts about cannabis are positive. There's 4 positive messages about cannabis that young people are consuming for every 1 negative one. So that's why attitudes are changing. And I suppose the doctors I work with would argue that the government, you know, or some statutory body needs to step in and communicate the facts and hazards and harms of cannabis to young people more clearly, because they do not understand the problems that this drug can cause.
Thanks, Bobby. And just to remind the members who will, prevention and education is the focus of our next Assembly meeting in particular. Anne, can I ask you, do you want to make any comments on either question?
Yeah, just to follow on for that, obviously we need to make sure that the education is more suited, I think, to the people who we're targeting, and that the target groups are properly thought about in terms of how we construct the messaging. So it's going to be a big job, I think, for public health, and I think public health need to be properly resourced in terms of being able to give messaging in a way that people actually receive. Because again, sometimes receiving your education in school can become that's school, that's whatever, but actually it's about utilising social media and getting it to people where they get their information, and making sure that the information is accurate would be really key.
And good examples during COVID where information was shared, factually based, people interpreted and listened. Graham, do you want to make any comments on either?
As we kind of outlined in what our regulatory model would look like, particularly for cannabis, it's the same as what the Joint Committee of Justice recommended after they look at it. So it would be home cultivation for personal possession, and then that you could also supply the small social clubs. And the main reason to do them straight away is just straight away remove income from the gangs, provide people who want access to cannabis with access to safe cannabis. And then also further down the line, I do think the state should step in and set regulatory quality control. Similar to alcohol, you can go and choose to buy a beer or to choose a stronger spirit. I know some people asked about seeing gang crime stuff going down. So as you saw, obviously they have less income coming in, and then from that money, some states have ring-fenced the money that they've made from cannabis legalization and invested it into preventive services or into healthcare and this kind of stuff. So we think that would be important to do as well as part of a regulatory model. Thanks.
Eddie, I will bring in another questions. Can I go to table 6 and table number 3, please? If you have a question, and again, if table doesn't have a question, that's okay too, or if it's been asked. Marie, just the microphone there, Marie.
Professor Smith, thank you for your enlightenment. I noticed on your graphs 68% was cannabis, but coming fast up the rear, 60% crack cocaine. We'd love some more information on that. Is crack cocaine moving faster than cannabis? Or what is the differential there, please?
Thanks.
Thank you.
Thank you, Marie. And what table did I say? Did I say 3? 3, yeah.
How's it going? Graham actually made one of the points I had written down on my paper here about people wanting to buy a beer or a vodka. But Bobby, my question to you is, you're referencing the States, obviously a much bigger country than us, and with federal states, different governments, all that stuff. As a rural teenager growing up in Ireland, it's fair to say that there's criminal gangs in the most remote places in the country. I think they're everywhere as it is. But would you not agree that 50% of the cannabis market being black market is still better than 100% with the other 50% regulated?
Okay, so 2 questions, and I'm going to go straight to Bobby first. The issue of crack cocaine and trends, and then the market and availability.
Okay, so in terms of crack cocaine, I work with adolescents that's under 18s. I do a small bit of work with people up to the age of about 21 in one setting. Crack cocaine just isn't an issue in under 18s. It has not moved into that age range. We haven't seen anyone with a crack cocaine addiction attend the services I work in for under 18. So that's good news. And those services I work in serve the deprived communities that were badly affected by the heroin epidemic. As far as I can see, the bulk of the crack cocaine problem seems to be in the exact same group of people who were caught up in the 1990s heroin epidemic, and a proportion of those who continue to struggle with a range of polysubstance addictions over the last 20, 30 years. They've now, crack cocaine is the current drug. In 5 years' time it will be a different one. And it's devastating in terms of its impacts on the lives of those people. But fortunately, you know, in terms of its movement into the wider community or the adolescent age range, it's just not an issue. Although, as I said, media love it. The media love hyping up crack cocaine. And the question about 50% of criminals, you know, like, for me, drug policy is about keeping people healthy and well, and that's the only thing I really prioritise. I'm resigned to the fact there's always going to be criminal gangs. I'm not going to make that more important than keeping people healthy and well. And if you're sort of saying in order to give the criminal gangs a bit of a bloody nose and remove half their income, we need to regulate the market that's going to drive up health problems, for me that's not a price worth paying. They do annoy me. I think the simplest way of getting rid of reducing the income of the criminal gangs is actually to reduce drug use. If less people use drugs, they have less income. That's what I would like to prioritise in order to reduce their income.
Thanks, Bobby. Just for ask Eddie to make any comments, can I just ask our next set of panellists to get ready, please, because we have an immediate transition to the next panel straight away with no break. So, Eddie, do you want to make any comments, please?
Yeah, a couple of comments over the last few questions. Again, agree with Bobby. From my own drug treatment centre, the vast majority of people we have using crack cocaine are those who have been on the poly-drug thing for a number of years. Started off heroin users, now probably on methadone, benzos, and now crack cocaine. Devastating drug. You wouldn't want to see anybody on it. In terms of the legalisation, we're calling for the regulation of both cannabis and cocaine. Cocaine is a huge money spinner for the drug gangs. We are not going to get rid of the drug gangs by just regulating cannabis. So we want you to look at both those particular drugs to try and remove the vast majority of the profit. In terms of the SPHE and the drugs education, a lot of research around drugs education in the secondary schools has indicated that it really has no impact on the young people after 2 or 3 weeks. And again, you know, possibly because maybe it's delivered sometimes by people who know less about the drugs than the young people are actually addressing. So that's something we do have to concern ourselves about. And also, one of the reasons why young people are often attracted to illegal drugs is because of the very fact that they are illegal. So it's part of that risk-taking behaviour by teenagers.
Okay, Eddie. Look, we're coming to a natural close where I have to do it. I want to just say to panellists they've been very forthright in terms of their positions and very clear, which is exactly as Table 4 said, what we need to hear and understand. So thank you for sharing your information today. Apologies that we have to keep it tight, but we've moved straight into the next session. And show your appreciation, please, for the panellists. Thank you.